Hello, and welcome to this episode of Registered Nurses in Primary Care. I'm your host, Emily Patton. We are privileged to have Dr. Carmi Johnson with us today. Dr. Johnson is an assistant professor and the Paul D. Coverdell Peace Corps Fellows Coordinator at UAB School of Nursing. Dr. Johnson is also a psychiatric mental health nurse practitioner with a faculty practice at Path Clinic for Diabetes, which is a UAB nurse-managed clinic. Additionally, she is the wellness nurse for the Nurse Family Partnership of Central Alabama. Welcome, Dr. Johnson.
Happy to be here, Emily.
Today, we will be talking about behavioral health integration in primary care. So, Dr. Johnson, what exactly is behavioral health integration?
So behavioral health integration is a newer term for a concept I think nurses have been doing for decades, which is when we talk about mental health. And that's kind of a newer term, too. I think for years we've used the term psych help, and people don't like that term because of the stigma, the taboo related to it about, well, I don't need psych help, I'm not crazy. But we've ignored the relationship with the brain, with our overall mental health in our body for years. And what we've ignored, too, is that when we're not feeling well, when we're depressed, when we're anxious, when we're stressed, that we're not going to attend to the things that we need to do to make us healthiest. We're not going to be, in terms of healthcare, compliant with our medication. We're not going to watch our diet the way we should. We're not going to want to get up and exercise. We're not going to want to concentrate on spending time with our family and friends. We won't be able to even do that stuff. And so then all of that, the kind of that relationship does affect our behaviors. And so what we're specifically looking at with behavioral health integration is, if you're not feeling well, what are you not able to do? And how do we normalize that? How are we able to just kind of talk about that for people so that they don't feel, oh, I'm not crazy. I'm just not feeling as well as I can. And that's a really important thing.
So why do you think that behavioral health integration is essential in primary care?
I think it's essential in all aspects of care. I share this, that I teach at the School of Nursing in the undergraduate program. And I ask, one of the first days of class, how many of you think that you will go into psychiatric nursing? And very few students raise their hand. Everyone's like, no, I don't want to do that. And I share that sentiment. When I was in nursing school, I thought, no, I'm going to work in the ER. I'm never going to be a psych nurse. And I tell them, every single one of you will be a psych nurse. You will all be mental health nurses. Because what's a normal day to us, what's us clocking in, is a traumatic experience for most of our patients if we're talking about the hospital. If you're talking about in a clinic, what is a normal day for us is a chance for someone to say, I don't feel as good as I should, or I've been having these thoughts, or I can't get out of bed the way that I used to. So I think that integrating that into primary care is something, again, that nurses have probably been doing all of, throughout the entirety of nursing. It's a profession of caring. And so asking those questions about how people feel has always been really important to us.
I like that you mentioned that as nurses, we all are mental health nurses. It's something I definitely experienced as a med-surg nurse that surprised me.
Yeah.
So were there any instances that you can remember as an ER nurse where you thought that it would have been helpful to have some kind of integration of behavioral health, or ways that you saw it being integrated appropriately?
I think, and that's what led me to it. Again, in nursing school, I was like, I'm ER all day. I like the pace. Mental health, that's for people that, again, that stigma, that taboo, that's for people with these problems. And we tend to put it in this idea of the severely mentally ill. And the fact is, it's all of us. Every single person is going to have times in which, they have anxiety, when they have stressors that weigh them down. And to be able to talk about that. And I think that the thing that really struck me, and it's the area of nursing I love the most, which is the ability to establish rapport, to therapeutically communicate. It's the thing that we, I think, across all other disciplines, teach the best. It's why people trust nurses the most. It's why there was this really great study that I'll just refer to quickly that looked at the amount of time that providers spend with their patients. And they gave them the same amount of time, 10 minutes. But when they asked patients later, how much time do you think your nurse or your nurse practitioner spent with you? The patient said 15 minutes. And it was like, no, they really only spent 10. but that idea of establishing rapport, of asking questions to elicit how the patient feels, what's really going on with them. We do that very, very well. And so I think that that's something that as a primary care nurse, as a registered nurse, just being able to utilize that. Because I'll be honest, when my nursing instructors told me that you will have this skill, I was very interested in starting IVs and that kind of thing. And that has been the skill that has helped me out the most. Prior to me deciding to specialize in psychiatric mental health nursing, that was the skill I thought that I really connected with my patients because I could listen to them. And they felt at their most vulnerable enough trust in me to share this kind of information. They trusted me enough for when I said, have you thought about doing this? How do we normalize the way you're feeling with what you can do? That to me is a gift. That's a gift that nurses both have and are given.
Yeah, I think that's so important. So you have a faculty practice at the Path Clinic. Tell us a little bit about ways that behavioral health is integrated into that primary care setting.
Yeah, what's wonderful is we get to utilize the ICPC model. So we have an interprofessional collaboration model that we use doctors and optometry and social work, dietitians. And so what's great is I think oftentimes we're hesitant to ask people about how they feel about if they're depressed, if they're anxious, if they're suicidal, because we're afraid that we don't know what to do if the answer is yes. We'll avoid the question because we're like, I don't know what to say if the answer is yes. And I think having that model, being able to work within that clinic and integrate some of what I do, I tell people that what I do, not that it's easy, it's not as difficult as people want to make it. It's not as difficult as just caring enough to ask. It's the thing I tell my students, you don't have to know all the answers, but you should know some resources. And you shouldn't be afraid to ask those questions. And so I think that one of the things that I think has been great for me is it's given the other providers a level of comfort to ask. We've had the same thing happen with the other partnership that I work with, the Nurse Family Partnership, which we have home visiting nurses that go to first-time moms in Jefferson, Fayette, and Walker County. And I'm there as a resource to them. But what's been wonderful is that the connection that they've made with their assigned registered nurse, so much is revealed, so much that we've seen that we did not anticipate. People being able to talk about intimate partner violence, people being able to talk about this concept that we don't assign under mental health, but loneliness. What happens when you're isolated? And being able to feel open to talk about that has been something that just me providing backup for these wonderful nurses who do the work and who make these strong connections because we're trained to do that, because we have been given the gift of being able to do that is something that I've just loved being a part of.
I like that you mentioned the interprofessional care team and the different roles. Can you tell us a little bit more about specifically the role of the RN as part of the interprofessional care team in integrating behavioral health? Yeah,
I think that, again, it goes back to that level of trust, that I think that when people are going to open up with their vulnerability, with how they're feeling, I do think it's going to be to nurses. You're going to be it's not even that friendly face, it's that caring face that also is matched with that professionalism to know. I think that that's the person they're going to share these things with. They're going to feel they have the time. They're going to feel that this person is going to want to hear these things. And so I think having that openness to hearing that, to knowing that you also have the professional backup to do it, is huge. And that's what patients want. They want that great combination that nurses can provide.
Well, Dr. Johnson, this has been very informative, and we thank you for being here with us today.
Thank you so much for asking me.
Yeah, thank you. So please join us for our next episode of Registered Nurses in Primary Care.